Part B, again, Part B is your doctor bills. There are premiums for Part B. This year for 2020, the amount is $144.60. I would write that down. So for Part B, it does have a monthly premium, and this year that monthly premium is $144.60. If you've already started taking Social Security, the Part B monthly premiums can be taken out of your Social Security check. For Part B is optional. You do not have to enroll in Part B. But if you do not enroll in Part B and you wait 2 years later and then decide you want to enroll, here's what's going to happen. One is there's going to be a 10% penalty for every year you did not enroll where you were eligible to enroll. That is not a one-time penalty. That is an ongoing penalty for the rest of your life. So keep that in mind. You do not enroll at age 65, you come back 2 years later, whatever the case may be, you're going to have to pay a penalty, and you will continue to pay a penalty for as long as you live. The initial enrollment period, IEP, is for 7 months. Again, at age 65, you can use the initial enrollment period to enroll in Part A and Part B. The way that works is the period is 3 months before the month you were born, the month of your date of birth, and then 3 months after. So you have a total of 7 months there to use the IEP to enroll into Medicare B. There is a general enrollment period, GEP, that starts January 1st through March 31st of each year. I would write this down as well. Part B has an annual deductible of $198. $198. 80%, 20% co-insurance. Part B covers 80%. The other 20% you pay, or you find a Medicare supplement plan or a Medicare Advantage plan that will cover that 20% that Part B does not cover. Here's another way of looking at that, just in a calendar form. So let's say you were born in the month of April. Then you have 3 months prior to the month of April, the month of April, and 3 months after. Now, when you turn 65, that's one of those big birth dates when you turn 65, because that's when you're going to have the most control over your health care. When you turn 65 and you enroll, you do not have to disclose any health conditions, any medications that you're on. You don't have to tell who your doctors are. So this is one of those unique windows where you're going to have the most control over your health care benefits through Medicare. So you need to make sure that you get it right while you can. Part D is for drugs. That's your drug plan. I would write this down as well. There are 2 types of prescription drug plans. The first one is a standalone plan. And how that works is if you decide that you want a Medicare supplement plan to cover the 20% that Medicare does not cover, you will have to get an additional drug plan outside of that Medicare supplement plan. The second type of drug plan is with what's called a Medicare Advantage plan. Medicare Advantage plans already include a drug plan. That is the end of today's video. Again, if you have any questions, you see my email there, mowens@cfsgroup-nc.com, or you can call me at the number in the left or right-hand side corner, 252-215-9095. Thank you.